And welcome back to the CTLA4 Chronicles.
Hello. We actually didn't even really want to film this tonight because I don't feel great, and it's been a long Sunday for being a relaxed Sunday.
Yeah. We're going to try to stitch in some pictures just to show you guys today, like what we've been going through, and unless she's not feeling well. So part of actually, this goes into the update if you want to take
Like the family update, because yesterday we filmed kind of like a rant-ish thing, and I don't know. So I'm dealing with like tons of swelling and just like kind of systemic edema, which it's like my cells are just leaking fluid out into like my muscles and I don't know, like extra spaces, I guess. So I'm on Lasix, which make you pee out all of that, or, to an extent, some of it. And I didn't take them this morning because we were going on like a little road trip with the family. And I knew when you take Lasix, you have to pee like every 15 minutes. So, and I can't use public restrooms. So it turns into a whole thing because he either has to go in, and like when we have the kids with us, it's just hard. So I was like, it's fine. I'll take the Lasix in the afternoon. And then while we were out, I was just like getting literally like bigger and bigger almost by the minute. And I took them before we got home, and I've lost 5 pounds.
Yeah, in a few hours.
In a few hours just from fluid, which is absolutely ridiculous.
Yeah, so I could see the swelling like in her legs with her boots where they were zipped up, and then she went to adjust her rings and noticed it. So like I said, we got some photos. Hopefully we can get them to work with this and people can see the differences you're going through in a day and what makes it hard.
It's crazy, and I gaslight myself continuously because
why not?
And I'm like, oh, maybe it's just me, and like, I'm not doing what I'm supposed to do, or maybe I'm eating too much or whatever, and that's why I'm like putting on this weight, and I'm so puffy. I felt like I was gonna pop. And I explained that to my doctors, and then come to find out that like you actually can pop.
We won't put those images
No.
in. You can Google that yourself if you'd like.
Yeah.
It's not good.
I've talked to people on Facebook that are dealing with similar things or have dealt with similar things, and it's scary. So like finding out that was.
And the edema gets bad enough to the point, I don't think we have any good photos, but like where if I go to touch her calves or arms or anything, it's so swollen, the skin doesn't move at all.
Yeah, it's like taut is the word that they use. And it's like you can't pinch my skin at all. It gets so like I'm so puffy. There's nothing. Yeah. Nothing there. So that's been crazy. And I really didn't want to film, but with our schedule and everything else, it's just, we had to. Sometimes you just have to commit.
Well, they put you on some other meds too, right? Trying to help, because now after everything with your last couple appointments, it's for sure you have chronic graft-versus-host disease, which sucks.
So that's what I was on the prednisone for the last like 6 months, was trying to control that. Because my arms were so stiff, like my shoulder blades, I couldn't even like take a t-shirt on or off without Dan having to help me. And I like waited probably too long to tell my doctors about it, because I was like, oh, I'm just stiff. It's fine. Normal people can't raise their arms over their head. So I got put on steroids for that. And then it made it a little bit better. And then they put me on Jakafi, which is like a specific med for graft versus host disease post-transplant. And you're supposed to be able to come off of the prednisone when you're on that med. And that didn't work for me. As I came down on the steroids, all of my swelling got much worse, and that's a sign and a manifestation of chronic graft versus host disease, which means I've now failed 2 lines of therapy, which sucks because there's not a lot of different therapies out there. So now I'm on a new med that's got a lovely red label on it that says hazardous drugs, and can't crush it, can't break it, can't chew it, has to be taken
with food at the same time every day.
Every day, It can cause bone pain, might actually worsen my swelling. Maybe that's why I was so swollen today too. I didn't think about that. Yeah. And there's some other side effects, but like over time, it's supposed to rebalance my immune system. And I think like you reach like peak effect or whatever around 6 months. So it's going to take a little while.
Yeah, it's a wait, but it's worth it if it works out.
Yeah, that one's called Rezurock. It's a weird, these names are like so weird. I won't even pretend to pronounce the generic name or whatever, but it's called Rezurock, and it's the med that you take when you've failed other lines of therapy and you're not eligible for, what is it?
Oh, clinical trials.
Clinical trials. Yeah. So that's also a fun conversation when your doctors are talking about clinical trials, and it's like, you don't really have a choice.
Yeah, that one wasn't in the plan.
Yeah. I was doing really well. I felt so good almost immediately after transplant when I came home, after I got over like all the nausea and like we kind of figured that out.
Yeah. We were so active as a family and just you and I with the hiking, the walking.
Yeah.
you were paddleboarding all summer. We played a few rounds of golf, and then that went away quick.
And I golfed with like my dad and stuff, like 3 times, 4 times.
Yeah.
And I even like paddleboarded and golfed in one day. That was a little bit too much, but like the fact that I even did that's
Yeah,
insane.
your recovery looked like it was going so great.
Because it was until it wasn't. And like now, I try to walk. The loop that I do is like 3/4 of a mile. And if I do that, I like don't have energy to do almost anything else in the day. So that's frustrating because I like need to be walking, but because of the way graft versus host disease like can affect your body, it zaps all of my energy levels. Like I literally can't use my arms and legs. I joke that I'm like the wacky, wavy, inflatable arm man because as I'm trying to walk, like I can't pick my legs up, or I'll try to put like a cup down and like,
slam it and stuff. Yeah. Your coordination goes out the window pretty fast.
Yeah. So that's been awesome. Trying to stay positive.
Got to stay positive. What else?
Yeah, I mean, they ruled out heart failure and kidney failure and like fluid around my lungs and stuff. And
yeah,
like,
as I say, all your major organs are intact. Those are all working.
which like my like organs, major organs and stuff are working better than they did before transplant, like years before transplant. Yeah. And it's like almost frustrating to be like, this is great. I love that for me. What the heck is going on with the rest of me? And I'm like still falling apart. My cells are like, not disintegrating, but leaking.
I forgot to mute this. I'm just going to do it now.
I didn't mute mine either.
Oh, maybe that was you then.
No, it was you.
Oh, okay.
So that's been crazy. I'm going to Boston once a week right now too.
Yeah, appointments were monthly. That was really nice. And now we're back to weekly.
Yeah, and I should have like picked up on that like things were super serious, but like my doctors have a great poker face. And so like I didn't realize that they were looking for things that were incredibly serious and very hard to treat. We talked about that at my last appointment. They were like, at least it's not X, Y, and Z because that one's hard to treat. And I was like, oh man, okay.
Yeah, this is already going bad enough.
Yeah, that's frightening. Like this feels hard to treat, but I'm like obviously on another therapy and like, I don't know. It's a wild ride to think all of this has happened in just 1 year. Cause like being able to go on hikes and stuff feels like a lifetime ago for me.
Yeah.
And it's only a few months.
Even we didn't get to play golf by the end of the summer and the beginning of fall at all.
Yeah. We talked about that and
you couldn't do it.
I can't even like hold my arms up
Yeah.
for like past like 30 seconds.
Well, we had to get a new mirror because you couldn't even do your makeup. You had to be sitting now.
Yeah, I was doing like my makeup like I normally did for the 10 years we've lived here, where I just lean over the vanity in our bathroom and do my makeup. Yeah. It's not a big deal because it only takes me, it's like less than 10 minutes start to finish. And now I can't do that. And like leaning over, like the muscles in my back are weak. So then they'll cramp and spasm and I just can't do it. And I can't stand for that long. So, but I do love my new mirror.
Yeah.
And
what was the medication they gave you for the cramping in your legs? Remember? It's the foam.
Oh yeah, so that one's like you just buy it on Amazon, but it's magnesium foam that you put like directly onto your skin, so it gets absorbed into those muscles, and that's been phenomenal. If you have cramps or suffer from like muscle spasms and stuff, you should all put a picture of it in the thing so you can see what brand I bought. But I love it. It like was immediate.
That's awesome.
Yeah, I'm happy that there's some things that can be fixed as easy as like just putting some lotion on.
Yeah. I'm trying to remember if there was anything else that was like important over the last couple appointments you had. It's really hard sometimes, and we had to talk about this a few nights ago, for us to maybe show all of our emotions and feelings when we're doing this because you become like dissociated with it. And we've talked about that in past episodes.
Yeah.
And
I'm like shaking from talking about this because it's like, I mean, I talked to you about it.
Yeah.
And like some people kind of know, but I don't feel like anybody really knows like the whole extent aside from us.
Yeah.
Because like it's so in depth and there's so much that you have to understand about like where I'm at in this whole journey to understand like what's happening today.
Yeah.
And why it's like so, I don't know, important and traumatic and like.
Well, yeah. Well, that's what I'm saying is that like my comments were all this is going on and we deal with it every day. We then have to disconnect ourselves from emotion because you have to make important decisions, figure out how you're going to go forward. And it's like, I can't dwell on everything that's going bad. Just what can I do to fix it? Or how do we overcome the obstacle? Especially like to be a family, to have the kids, to do the school, the sports,
Oh, yeah.
the running around, even the self-care for ourselves kind of thing. Yeah. So we like, as we're talking about these horrific things, even like skin splitting from too much fluid retention, it feels like it's just, hey, we're talking about somebody else, or here's a news article I read and I'm telling you about it on this podcast. Welcome to the CTLA4 Chronicles. And that's not the case. It's just, and most people that have chronic illnesses have this disassociation at one point or another, or at least know how to differentiate when they're having these conversations. And like, I don't know, sometimes it just takes a lot to acknowledge that. And, you know, I feel I realized that more a couple nights ago after we were talking about all that other stuff.
Yeah.
Like, yeah.
Yeah, because like I go to a lot of these appointments alone because the way the schedule works out, if I have to be up there really early for like 8:30, I have to leave the house by 5:30, and then I can't drop the kids off. So Dan will have to stay home from work and drop the kids off. And then usually I'm home in time to pick them up. But if I have a later appointment, then we flip-flop. You know, I drop the kids off at school, do my appointments
way
and stuff.
Easier for me.
And then he'll get them after work. But so we can't go at the same time. And we really don't have a support system like at all. So, you know, I do, now it's my phone that's going off. So I do all of these appointments by myself, and I wish he was with me because it's like, it's hard. Yeah. It's hard to like hear about this stuff and then be in the room and like have your doctors talking about you like a house episode. Mm-hmm. And it's just like surreal almost. And like you have to disassociate, for me anyway, I have to, because if not, I wouldn't be able to retain like everything that we talk about, or 99% of what we talk about. And then, you know, almost immediately I want to call you because I'm like, if I can word vomit everything, then like we'll both remember
enough parts. Yeah.
Yeah. And like I could record the appointment and stuff, but like that kind of makes everybody feel weird when you do that. So they do a really great job of putting notes in. And like sometimes I'll go back and I'll read and I'm like, oh yeah, when they say they're concerned in my notes, that's probably pretty serious.
Yeah. And to speak to schedule problems and stuff, not only did you have appointments, but then so did our youngest. So
Catalina, on the same day. I forgot about that.
Yeah. So we were just constantly back and forth in Boston and just very busy ourselves up there, and doctor's appointments. So our youngest had to go up to Boston, and we did a
pulmonary function test.
Yes. And so she had a few things. She did amazing, which was great, because the first iteration they did was just having her walk up and down with O2 stats.
Oh, yeah.
Up and down the hall, did that. They had her doing breathing, and she was doing phenomenal. Like, she was meeting the criteria to do the test, which is really hard with a 6-year-old. She wasn't necessarily passing it, though. So we had some issues. Overall, the exam went well, and normal function was good.
They said that there was no, like, her stuff hasn't declined since the last time they did anything. Actually, I think her O2 stats were a little bit better this go around, which is good because, like, I think when we did it last time, which could have been a year ago at this point, I don't even remember.
Longer.
Yeah. She was coughing all the time and having, like, pretty significant breathing problems. And that's when we found that she's got permanent scarring in her lungs.
So they're treating it more like an asthma than anything else. But we had stopped doing some inhalers for her because she was playing so well, running so well, and we didn't even realize like the growth that she was having recently and how great that's been. But they told us we had to get back on all the inhalers and make sure that she has this for a rescue and this for her constants. And
it's called a SMART plan. And they told us that the inhaler that she's on, she has to be on all the time, even when she's feeling good, because it prevents like further lung damage and some of the other issues that she could face because of the CTLA4. So it's like a preventative.
Yeah, it's pretty rough and kind of sucks for her. She doesn't really mind it. It's just one of those.
One more thing.
Yeah, one more thing.
It's like one more med. And like, because we had stopped doing it, she's been excited about that because we've actually cut back significantly on a bunch of her meds.
Yeah.
And so, but I think we're going to have to start adding some back because we're dealing with, more flares and not to get away from the pulmonary stuff, but like she's been dealing with the bowel incontinence again. We've talked about that a few months ago. And it's been kind of on and off since she's been off the steroids.
Yeah. So poor kid's just having a hard time with all this right now, but.
Yeah. And we've got a video visit with Boston GI coming up.
Yep.
So I'm sure they're going to have insight into what's going on. I'm sure they're going to end up saying that it's like CTLA4 manifestations, like they did with me, because like we've both had, I don't know, tons of colonoscopies with biopsies, and like they'll see inflammation or they'll see T cells, but it's like it doesn't fit Crohn's disease and it doesn't fit ulcerative colitis and it doesn't fit like
anything else.
Yeah, so it just gets lumped into like manifestations of CTLA4, like which it is. It's just because it's not like Crohn's, it doesn't have the same treatment options. You can't get treated the same way. Some clinics won't even see you if you don't get like
a diagnosis.
Specifically labeled for that, which is frustrating, especially when we get referred by like the doctors that know those doctors. And it's like, why is there this protocol? It's like when insurance companies deny things and it's like, my doctor is the one that's saying we should do this. How do you have the right to say no?
Right.
But
man, we could do a whole episode
just on that.
I bet you we could do a live on just insurance and have some people jumping in.
I can't tell you the stuff that I've gone through just with our insurance and having to look up their rules and then like cite them line by line just to have them.
There's some things we can't say on film that we've said to insurance companies.
Oh, that's also true.
Keeping it spicy.
Yeah, so that's bananas. Did you have anything else said about Catalina?
No.
My sister, I do have a quick update on her. She saw a neuromuscular doctor earlier this week.
Yep.
And
that was a new one for me. I was very confused.
Yeah. And he actually said that like he didn't think that they were necessarily the right group to be meeting. Just because like the stuff he deals with is significantly different than her issues, but he's still going to do some testing and he's going to repeat some of her nerve studies. Remember the one where I talked about put the needle into your muscle?
Yeah.
So they're going to do that soon. And then she saw a dystonia like movement clinic doctor. And that woman was apparently super helpful. And that was like a good puzzle piece.
Oh, nice.
Yeah. So she started her on a new medication that my sister said like started working almost immediately.
Yeah. I think like a couple hours, she said.
Yeah. For her like muscle twitching and contracting and stuff, which like CTLA4 can have weird brain manifestations. And this woman looked at her MRI and said that she wants to repeat it because she thinks she sees some abnormalities, whether it's related to CTLA4 or another genetic condition my sister has, or we actually both have, called hematochromatosis. And that's where you build up iron in the body because this mutation, like I don't know exactly how it works, but like you end up with the iron deposits in your liver. And it can happen in other parts of your body. And sometimes that can happen in like this part of the brain that this woman was looking at.
Interesting.
So it'll be interesting to see like kind of what they say on this. Because my sister's also doing bloodletting for her iron overload.
She is Iron Woman.
My dad always called her Iron Heels. That's even funnier.
Yeah. I thought you'd appreciate like a dad joke in there.
Oh, I love dad jokes.
Yeah, I know.
Beautiful. So, and Renee out in like the middle of the country, she I don't think she sees the genetic doctor until April, but she's having like flares up and down, but nothing as serious as the one that like put her in the hospital where they thought she had a stroke.
Yeah. So
that's good to hear because that was one of my concerns was like, oh my gosh, they're making her wait like 6 months to get in with like nothing. They're not putting her on anything else. I don't know if they started her on steroids or what, but it's like to think like 6 months and you can have something that like almost kills you as a flare. Like that's frightening. So I'm glad that her stuff's been pretty stable.
Yeah. I mean, as you say that, I'm going to go back to the dissociation because like if we didn't figure this out with the swelling and you said something to the doctors and they then pushed for the medication you wanted, like this could have easily killed you.
Yeah. And like, I don't know, that's kind of crazy to think about. A lot of this stuff is crazy to think about because like we had so many complications in the hospital that are like hard to think back on and acknowledge. And like we had only posted a little bit about that. We didn't talk about it a lot. Like the kids don't really know about that. Some family does, but like I feel like when you talk to regular people about incredibly traumatic things like that, like they all
give you the same look and face like, how do you do it? Or they're just like, wow, neat. Because they just have no idea
process
none of the words, whether it's the medical terminology or the fact of like what's happening.
So that's crazy. And like I said, to think like all of this has happened just this year is weird because it feels like so long ago.
Yeah.
That's probably me disassociating and then just shoving that to the back of the brain. I'm like, that was definitely 10
I've called
years
you
ago.
out for it a lot.
Yeah.
This whole summer has been like that.
Yeah. Even Juliana's come to me and been like, your transplant feels like it was yesterday, but also feels like it wasn't even this year.
Oh, yeah.
And like, so the kids feel it.
Yeah, they get it.
And it's hard. Actually, which is funny, like the kids get it, but then at the same time, like what I was telling you yesterday or the day before, I said something about like being sick or I can't wait until I'm less sick or not sick. And all three of the kids were like, what are you talking about? Like, you're not sick anymore. And I was like, what do you mean? Yeah. And they were like, well, you're cured. And like, I think maybe because my hair is growing back and like I'm home and walking around, like they think that I'm good to go, which was...
I don't know if it's that or if it's the fact that they don't see you like, with a fever, sniffling, coughing, throwing up or something.
Right.
To them, watching you walk around and be almost normal is like, oh, mom can't be sick.
Yeah. No, that makes sense. That's another like almost disassociation too. Because
that one could be a misunderstanding, but I agree with you. I think it's either one.
Yeah. So that's been interesting. Yeah. I don't know.
On that note,
I'm a little hungry.
I guess so. It's time to end this one.
Yeah. We have a lot of appointments that are still coming up. I have one this week. Catalina's got a few. So I'm sure we'll post an update. I don't know if we're going to do like weekly updates right now with the podcast. I just don't want to commit to that because I'm so up and down with how I feel.
Yeah.
Which is, you know how crappy that is to like say out loud because like we just got the audio fixed on this.
Not only that, but it's like what you want to do. You want to constantly be like telling a story and having interaction with people and stuff. And like, I can see it when you're weak and you physically can't do it. Because aside from the audio and the sports, like there's plenty of times that we had some time to record a podcast here or there.
Yeah.
And you just physically weren't able to.
Yeah. It's like really frustrating living in this body. Because like my brain hasn't changed. I still want to like do all the things.
Yeah.
I know we said we were going to end this, but now it's just a rant session. All my feelings. And I'm sure there's people that feel that way too, especially if you have like something traumatic happen.
Yeah, of course.
Like all of a sudden your legs don't work and you're like, what the heck? That's how I feel with like so many things, like my weight, the muscles, like how was I doing so much this summer and like so active and like living life to like being housebound almost. Again. Yeah. And then like, of course you get depressed when this stuff happens and you live this kind of crazy life. And that's like, I finally caved and was like, fine, I'll take antidepressants. And then they told me I can't take antidepressants because of the medications that I'm on and like the interactions they have. And I'm like, are you kidding me? Like I finally caved and asked for help. And I was told,
can't give it to you.
Think happy thoughts.
We've heard that one before.
And like, they didn't actually say that, but they were like, you actually can't take like any of these and it's just probably not safe right now. So, you got to find other outlets. I mean, they almost basically said happy thoughts. Yeah. Like, do you like crafting? Yeah, when my hands work. Do you like to bake? Yeah, if I could stand for the time it takes to bake and not be in pain. This is just going to get sadder and sadder. We should probably stop.
On that note,
we'll see you next time.
Thank you for joining us on the CTLA 4 Chronicles. Until next time.